Hello, my name's Lauren. I'll be your nurse this evening. Can I ask your name and your birth date? At this time, the patient will state their name and their birth date, and I will verify that this is the correct patient. I'll let them know that I'm performing the peripheral vascular assessment along with the abdominal assessment. I'll perform hand hygiene. I'm going to provide privacy, and I already took the vital signs. The vital signs are within normal limits, and the patient has no complaints of pain. Okay, now I'm going to move on into gathering some subjective data or any history related to the assessment. In regard to the peripheral vascular assessment, I'm going to ask them if they have any swelling in their arms or legs, if they have any cramps, pain in their arms or legs, or if they notice any skin changes, or if they have a history of vascular conditions or diabetes. In regard to the abdominal assessment, I'm going to assess whether they have, or ask if they have any history of nausea or vomiting, if they have any history of food tolerance or bowel habit changes, if they have a history of, hepatitis, appendicitis, if they have a history of ulcers. Okay, now I'm going to move on with the assessment portion of the exam. I'm going to begin by assessing both arms, the upper extremities. I'm going to start off with inspecting both arms, checking for any lesions, any discoloration. I'm going to assess the temperature, make sure they're both equal. I'm going to assess the capillary refill. Normal is less than 3 seconds, and it's to check for adequate circulation. So I press on the fingers. I wait for the blood return. It's supposed to be less than 3 seconds, which means it's normal. I'm then going to move on with checking the pulses in the upper arms. First, I'm going to start off with the radial pulse. I'm going to check both bilaterally, inspecting the force and the strength and making sure that they're equal. Normal is +2. Okay, I'm going to move on to the brachial artery. Again, assessing the strength and the force, checking if they're both equal bilaterally, and it's +2. Then I'm going to assess the lymph nodes in the upper arm, which is the epitrocular area, which is right under the elbow region. And you're noting whether you feel any lymph nodes. Normal is non-palpable. You're going to assess whether there's any tenderness, any movable lymph nodes that you feel. Now I'm going to move on to the lower extremities, the legs. I'm going to inspect the legs for color changes, any lesions. I'm going to inspect both sides for the temperature. It's normal for the feet to be a little bit cooler. Okay, then I'm going to move on with checking the pulses bilaterally. So first I'm going to start off with checking their femoral pulse. Okay, I'm going to check both sides bilaterally, checking to make sure that the rhythm is equal and normal, which is +2. I'm going to rate it as a +2 for being normal. I'm going to then inspect the inguinal lymph nodes. So normal again is where there will be non-palpable. I'll ask the patient if they're feeling any tenderness or any pain at this time. I'll check to see if I feel any prominent lymph nodes. Then I'll move on to the popliteal artery. I'm going to assess that, which is right under the knee, or right on the back side of the knee. I'm assessing again if they're both bilateral or equal bilaterally, and I'll rate that as a +2. Then I'll move on with assessing the posterior tibial artery, which is right inside of the ankle. I'm going to assess if they're both equal bilaterally, +2 if they're equal. And then I'm going to assess the dorsal pedius. And it's right on top of the foot. I'm going to check them to make sure that the strength and force are equal in both of the pulses. And I'll rate them a +2. Then at this time, I will check for any edema. I'm going to press down on the shin of each leg. I'm going to assess if there's any pitting or any indentation, and see how long it takes for the tissue to come back to normal. Okay, now I'm going to start off with the abdominal assessment portion of the exam. I'm going to start off with inspecting the abdominal region. I'm looking for the contour and symmetry. I'm checking the skin, make sure the skin is normal and there's no discolorations. I'm inspecting the pulsation of movement of the abdominal region. I'm then going to move on with osculating the bowel sounds. So I'm going to have them lay down. I'm going to start at the right lower quadrant and work in a clockwise pattern. So I'll listen to the right lower quadrant for at least 2 minutes, listen for any bowel sounds. I'm going to move up to the right upper quadrant. Again, listening for bowel sounds. I'm then going to move to the upper left quadrant. Listen for any bowel sounds. And then end in the left lower quadrant. If I don't hear any bowel sounds, I'll listen for 5 minutes. Now I'm going to switch my stethoscope to the bell, and I'm going to assess if there's any bruits. Now I'm going to first start off at the renal artery, which is at the level of the umbilicus. I'm going to listen to the side. I'm going to assess for any whooshing or blowing sounds on both sides. Normal is no presence of these sounds. Okay, I'm going to move on to the iliac artery. I'm going to assess for any bruits. That's just below the umbilicus on both sides. Assessing for any blowing, whooshing sounds. None of these sounds is normal. Then I'm going to move on to the femoral bruit, which is right below the iliac artery. And I'm assessing for any bruits. Okay, now I'm going to move on to percussing the abdomen. So I'm going to percuss the abdomen in all 4 quadrants. I'm going to tap my finger, and I'm assessing for the tympany sound, which is normal where you'll hear that in the stomach and intestines region, which is a musical sound. Okay, now I'll move on with palpating all quadrants. I'll do light palpation, starting in the right lower quadrant. I'll move to the right upper quadrant with the light palpation, asking if the patient has any tenderness or pain as I do this. I'll move to the left upper quadrant, light palpation, and then I'm going to move to the left lower quadrant. And as I lift up, I'm going to see if the patient has any grimacing, or if they complain of pain. That's a sign of rebound tenderness, which is a sign of appendicitis. And I will note if the abdomen is soft or non-distended, or if it's hard. Also make note if there's any hernias on the abdominal wall. It's the bulging of the organs through the tissue of the abdomen. It will definitely be visible, and the patient will complain of pain and swelling at the site. Now that I'm done with the assessment portion of the exam, I'm going to give my patient some health promotion. I'm going to let them know to wash their feet regularly. I'm going to have them trim their nails to prevent any type of foot infection, especially if you have decreased circulation to your legs, such as in diabetes and decreased filling. I'm going to tell them to take walks every day. This helps increase the circulation to your legs and lower extremities and prevent edema. Okay, I'll end the assessment with asking the patient if they have any questions or if there's anything that they would like to add or tell me. I'll then wash my hands, and then I'll go document my findings.